Welcome back to another Bali COVID-19 update. My name is Bruce and this is August 29th, 2021. And some good news today, again. So, how many days in a row? I don't know, but it's getting better and better. Let's take a look at the numbers first. New cases in Bali have been going down. So, what about the average? We'll get to the new cases in a minute. 7-day average for new positive cases down to 613. And it's 8 straight days that we are under 1,000. So great news. And the 7-day average for deaths is dropping as well. It's down to 48. And so our 7-day numbers are looking good. And in all of Indonesia, 10,050 new cases. So we're almost below the 10,000 mark. Remember, we were at 50,000 not that long ago. So a lot of good things happening here. And testing, total individuals tested for yesterday, 104,314, 9.6% positive rate. And the 7-day average is 12.9%. Now, just a week ago, it was around 20%, and now we're down to 12.9%. So, as I said, looking good. And what about Bali? Some people have asked me about the Bali. Bali does not report testing data. As far as I know, I haven't been able to access any, so we're just going to have to go with the national testing data. And what about vaccines? Vaccinations in Bali. First doses, 3,162,690, that's 73.3% of the population. And second doses, going up again, 1,745,174, 40.4% of the population now are fully vaccinated. And yesterday, numbers of new vaccinations dropped 2,308 additional doses yesterday. And what about the numbers for Bali? New positive cases, 474. Recoveries, 824. Deaths, 34. And current active cases, 7,607. So, wow. These numbers are just plummeting. Such great news. Out of the 474 new cases, all are Indonesians, and 404 are local transmissions, 67 are from domestic travelers, and 3 from international travelers. And what about by regency, or Kabupaten? Denpasar 116, Badung 75, Gianyar 69, Tabanan 64, Bulang 49, Bangli 48, Jembrana 23, Karangasem 14, and Klungkung 14. And so those are the numbers for today. And so the numbers are looking good. And it is a beautiful day, looking out the window here at the sea. And so, yeah, I'm pumped today. And what about vaccines and vaccinations? Let's talk about that next. Okay, so we've seen the numbers. Still trending down. Good sign. What's going to happen tomorrow? On Monday, will we see Bali drop to level 3? Will we see the restrictions continue on? Well, I don't know. What about vaccines? Indonesia is going to receive 80 million vaccines in September, according to this article. So we're going to receive 80.7 million doses of vaccine through government purchases and multilateral donations, according to the health minister. So far, the country has administered 91 million doses of COVID vaccine since January, and it's hoping to deliver 2 million per month this month, but I don't think that they've reached 2 million at all, and the month is just about finished. And one of the problems is a shortage of vaccines in certain areas of the country. A vast majority of the upcoming vaccines are going to be from China's Sinovac Biotech, either the CoronaVac or the Indonesian version renamed as BioVac vaccine, which is produced by the state-run pharmaceutical company BioPharma under license from Sinovac. And the government will get 2.25 million CoronaVac doses and 23.3 million BioVac doses next month. That's a few days from now. Also coming are 7.1 million doses of Pfizer, 5.4 million doses of AstraZeneca, which have been purchased by the government. And additionally, we are going to get COVAX, to the vaccine donor COVAX, we are going to get an additional 19.4 million doses. And according to this article, we're going to get another 500,000 doses, a donation from a foreign government. Doesn't say which foreign government, it's just a foreign government. Altogether, bringing us up to 80.7 million for the month of September. Pak Budi, the health minister, said that in some cases shortages were attributed to distribution problems, and I'm going to talk about that in just a minute. And one unique way to solve that problem. And Pak Budi said, assuming that we average 1 million doses per day, we have enough supply for 25 days. Now, the idea is to get to 2 million a day, so I don't know, we'll go from 2 million to 1 million, 1 million to 2 million. And one of the problems has been that some regional governments have opted to keep half of their deliveries in their stock to ensure supplies for a second dose, and he is encouraging them to use up all the available vaccines to get everybody, or as many people, vaccinated the first time as possible, and not worry about the second, that the government will supply them with enough vaccine for the second doses. So this issue with the distribution of the vaccine around the archipelago, and this is a huge place, right? In order to allow transparent vaccine supplies to regional governments, the health ministry has created a website that contains real-time vaccination stocks and availability down to the district level, and so everybody can check the delivery volume, the amount of administered doses, and the outstanding stock in their respective areas. They can also calculate the vaccination rate on a weekly or daily basis, and so Pak Budi said, we now have a transparent system that allows mutual checks into vaccine supplies. And so that is a good thing. Transparency is always a good thing. And so what about the vaccinations and the vaccine? I was talking about the previous segment about the number that we're getting in September and the difficulties in distributing vaccine across this vast archipelago. Well, Indonesian Navy set sail on maritime vaccination drive. So the Indonesian Navy has gotten involved in this because you get out into what's sometimes called the outer islands, and population is pretty sparse, a lot of people out fishing. So Indonesia's taking its vaccination drive to the sea in order to inoculate as many people as possible. And the Indonesian Navy has deployed 60 boats and warships to cover thousands of kilometers of coastline in the hunt for unvaccinated fishermen from westernmost Sumatra to the holiday island of Bali, all the way out to Papua. And among their targets, the Navy warship deployed a flotilla of rubber dinghies with a crew and vaccines aboard, willing to give shots to any fisherman that wanted it. And in this case, in rickety boats off Sumatra. And you see the photo right there's a photo up. There was a photo at the start. Here is a bigger version of it. About 1,000 fishermen have been jabbed since the nationwide program kicked off last week. Authorities don't know how many people are out there. Well, and then if you've been out fishing, and I've been out sailing through these islands many times over before the pandemic, and yeah, there are fishermen everywhere. According to the Navy spokesman, bad weather is usually the biggest barrier in finding fishermen and in administering the vaccine. And he said they just really don't know where people are, and so they're expanding their search areas. He said, we're just combing the sea. Some fishermen spend weeks or even months far from the coast. Others, closer to shore, often leave for work before vaccination centers open and return home after they're closed, and so that's why we're taking the initiative to find them at sea. According to one fisherman, he said, we know the government is supplying vaccines on land, but we just don't have enough time to get one. Our lives depend on the sea, and so the Indonesian government is going out to them. Okay, great. It's nice to see that the fishermen are not being forgotten in this. So we've talked about vaccines and vaccinations, getting a lot of new vaccines and vaccinations. The Navy is out vaccinating fishermen around the archipelago. Good news. And some controversy and scandal in the government. Booster shots for senior officials cause outrage. So the government is taking some heat for reports about some high-ranking officials receiving a third COVID-19 vaccination, the booster shot, even though most people in Indonesia haven't received the first one yet. And the healthcare providers, most of them had not received their booster shot, but we've got some government officials who've had theirs and who were, well, seemingly very happy about it. And so according to this scandal took place when footage of the president was released talking with several officials during a visit to Samarinda. And during this live stream video, Pak Jokowi was talking with officials including the defense minister, Prabowo, Indonesian military chief, General Hadi, the East Kalimantan governor, and Samarinda mayor. And they were talking about how they had received their booster shots already. Once the exchange between the president and his high-ranking officials went viral, palace media officials quickly removed the video from YouTube and then uploaded it later with the part about the booster vaccines being taken out. So a little erasing of history here. And since then, according to this article, officials in question have largely dodged questions about the booster jabs, or they've changed their stories. For example, Pak Hadi said that he did not receive a third dose, but that he had taken stem cell treatment as a booster. Elena Chiptadi, the co-founder of the watchdog group Kawal COVID-19, said that such behavior among public officials was unfitting, as millions of people are still waiting to get their first shot. She said, "It's outrageous that public officials are misusing health workers' share of vaccines while many people are still scrambling even to get their first shots." According to data from the health ministry, more than 70% of the population have not received their first shot yet, but we have some government officials getting their third shot. Additionally, only 34.23% of health workers have received their boosters, while 16.93% of elderly and 5.8% of vulnerable groups in the general public have received their second shot. Amnesty International Indonesia called on the government to prioritize vaccines for persons who have a higher risk of being exposed to COVID-19. According to the Deputy Director of Amnesty International Indonesia, giving a third dose to officials in such a situation is unjustified and reflects the government's indifference to the public's needs. And as a resident foreigner, I will leave my comments about this situation unsaid. And so we've looked at the numbers and we've looked at the vaccines and vaccinations. And here's an interesting article talking about Dr. Ketut Swarjaya, and I've talked about him before. He's the head of Bali's Provincial Health Office, Health Department, and he's talking about the 3 leading causes of COVID in Bali. And in his opinion, the 3 leading causes listed in order of significance, and this is from an article in Bali Discovery: the growing contagion of the Delta variant, high levels of public mobility, and the congregation of groups and crowds in several areas across the island. And so he said, he talked about how the Delta variant is much more contagious, and we've talked about that many, many times. And he noted something that, well, seems pretty extreme to me, although sometimes I think I should be doing this, which is, he said that people should use a face mask even at home, except when they're sleeping. He said if we're lax and careless for only a moment, one member of a family with weak immunity will be attacked by the Delta variant. And so, yeah, there are times when I'm around my wife who's out in the market all the time and down in her warung, and nobody wears a mask here. I'm thinking I should be wearing a mask around her. But are people going to wear a mask at home when they don't wear a mask when they're out in the street? I don't think so. So I don't think that's going to happen. And in terms of high mobility, he said that there's many areas and public gatherings and congregations that can become infectious clusters, and particularly religious and cultural activities, and the popularity of traditional markets, of course, which are still always crowded, at least here in Bulaang from what I've seen. And Dr. Surjaya said that the health protocols need to be strictly enforced in the public markets. So this is another reminder of follow the protocols, follow the protocols, follow the protocols. Are people doing it? I think you're getting the drift if you've watched the last few videos here, that as we go on and on, we're getting farther and farther away from that. More and more people are getting lax, and I think this is one of the things that he mentions here. On the topic of herd immunity, is Indonesia going to try to reach herd immunity, or, as I discussed in the last video, go for control over eradication, or do both? Well, new article talking about the IDI, the Indonesian Doctors Association, reminds the government to prepare a backup plan. So the Indonesia Doctors Association, citing a study from Australia that highlighted the minimum requirement for a vaccinated population to reach herd immunity based on COVID-19 vaccines with various degrees of efficacy. And so they suggested to the government that 86% of the population needs to be vaccinated in order to achieve herd immunity, not the 70% that has been being thrown around since way back when. The IDI Deputy Chairperson, Selamat Budiarto, said that the suggestion to extend the herd immunity number to 86% was heavily based on the efficacy of Sinovac vaccine of up to 70%. And Sinovac is the prominent vaccine, the one that's been most widely used in Indonesia. He said the Sinovac's efficacy at 70% means that 86% of the population has to be vaccinated. And he said that means that the government needs to review its target, and the target was 208 million, and that needs to be changed now. So he said the government needs to revise its target, and the target was originally 208 million, which was 70% of the population, and needs to vaccinate more than 208 million. And he said that at the current vaccination rate, it would take another 7 to 8 months to reach herd immunity. So let's say September, October, November, December, January, February. Well, that's in line actually with some earlier government predictions just to get to the 208 million. So we're looking anyway into next year, let's say March. And the good doctor added that the group of early vaccine recipients, of which my oldest daughter was one, who were inoculated in January, February, March, and April, will need to have a booster 6 to 12 months after their vaccination date. So, there's herd immunity again. Are we going for herd immunity or not? The key thing at this point seems to be vaccinate, 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 and try to keep up the 3 M's, although social distancing, forget it. In the last video, I discussed Pak Luhut's thoughts on the difficulties of achieving herd immunity, and perhaps the best way forward to that might be to stop trying to get a zero sum and instead learn to live with it, to control it. And so here's some comments this week from Health Minister Budi Sadikin. Endemic COVID-19 plan gets lackluster response from the Jakarta Post. So over the past few weeks, as I said the other day, the government's been thinking about changing their approach to handling COVID-19 pandemic. And so authorities are now exploring the idea of living with COVID in the long term. And the health minister told the press this week that he was in the midst of formulating protocols for treating the coronavirus as an endemic disease. The concept of transitioning from a pandemic to an endemic disease, that's when the virus has a constant prevalence in a population, and you can predict what it's going to do, and you can build plans based on that on how to control it. Booty said the government aimed to intensify the health protocol observance, vaccinations, and the 3 T's of testing, tracing, and treatment. And that includes using the Peduli Lindungi mobile app and imposing multi-tier community activity restrictions, otherwise known as PPKM, until the end of the pandemic. And how do the Indonesian people feel about this change in approach from trying to get rid of it completely to being able to control it? Well, according to this article, most people are more concerned with their economic well-being than they are with COVID-19 itself. And it also noted that others are fed up with the slow progress in dealing with the pandemic, and they hope that eventually this will all go away one day and the government will be successful and end the seemingly endless health protocols that extend from week to week. What factors are involved in declaring COVID-19 as an endemic disease? According to Mastalina Payne of the Indonesian Epidemiologists Association, in order to control the pandemic, the government needs to set up a roadmap to strengthen its pandemic awareness and response. Also, Indonesia would need to produce its own test kits, vaccines, and protective personal equipment, PPE, in order to build up self-reliance on outbreak control. Third, it would be necessary to set up a dedicated monitoring agency, something like the CDC in the US. And fourth, in order for COVID-19 to be considered an endemic disease, the country would need to bring down case numbers in accordance with parameters set by the WHO. These would include recording fewer than 20 daily new cases and fewer than 1 death per 100,000 people in a given population per week. And according to some experts in Indonesia, this is only going to happen in Indonesia after next year, when vaccine coverage is widespread and natural immunities then can help slow the pace of the outbreak. So we've got a ways to go on that front. And so we're talking about opening up. What's going to happen? Are we going to open up? Aren't we going to open up? What about Australia, right? China and Australia, 2 places accounted to approximately 50% of our foreign visitors the last time we were fully open. What about Australia? Story breaking: Qantas to recall 5 Airbus A380s in mid-2022. And so Qantas is feeling bullish, according to this article, and will be recalling its A380s in July 2022. And at the same time, Qantas is looking at gradually resuming its international flights as soon as December. So that's good news for Australians. So according to a media statement from Qantas, 5 380s will return to service ahead of schedule and would fly between Sydney and Los Angeles from July 2022 and between Sydney and London via Singapore from November 2022. And Qantas has hoped to resume some international flying by December, and it's sticking to that with vaccination rates accelerating in Australia and elsewhere. Spokesperson said that they're confident that the Australian government will soon start unwinding travel restrictions and border closures. That would be good news for Australians. Qantas said the key markets in the UK, North America, and parts of Asia, such as Singapore, have high increasing levels of vaccination, and so they would be targets. However, flights to destinations that still have low vaccination rates and high levels of COVID-19 infections will be pushed out from December 2021 until April 2022. And this includes destinations such as, yes, Bali, Jakarta, Manila, Bangkok, Phuket, Ho Chi Minh City, and Johannesburg. And so, not good news for us. And in a previous video, was it Wednesdays or was it last Sundays? I was talking about how the deputy governor wants Bali to become a quarantine area. Well, here's an article. The reason Bali is not an essential traveler's destination during a pandemic. And so the Minister of Tourism and Creative Economy, our old friend Pak Sandiago Uno, said that Bali was not chosen as an essential traveler destination as an effort to protect the island of the gods. He said the reason is that visits from abroad to Indonesia are considered to be the trigger for new transmission of COVID-19. Okay, we've got a lot of domestic transmissions. It seems more domestic than international, although we don't really have a lot of international people coming here yet, so that's neither here nor there. And what is an essential traveler? An essential traveler is a visit by foreign nationals in the context of essential business trips and official trips, according to Pak Sandiago Uno. According to Pak Sandiago Uno, Bali is expected to be able to reduce the COVID-19 cases so that economic recovery can work by opening international borders. And Bali has been named as the location for the G20 conference, which is going to take place next year. And so, in addition, Bali is being also pursued as a place for holding of World Tourism Day. Okay, I hadn't heard about that before. Pak Sandiago Uno said the opening of Bali is a symbol of our awakening, and hopefully we can gradually try it out and can be carried out a few months before the G20 kicks off, which takes place in November 2022, or at least the end of the third quarter. Okay, what did that say? It said we can try it out and can be carried out a few months before the G20 kickoff, which takes place in November 2022. Is he talking about waiting another year? Was this a misprint, a misquote? I don't know. That's whoa. Okay. And so what did he say? He said that Bali is a symbol of our awakening, and hopefully we can try it out and can be carried out a few months before the G20 kickoff, which takes place in November 2022. Whoa. Okay. I don't know. Let's see if there's any follow-up to this. Whoa, that's pretty, I don't know. I don't know what to say about that. November 2022? That's what's printed there. And so what about when the pandemic is over? What's going to happen when Bali is going to open up? Tourism in Bali has been a focus of a lot of discussion since the pandemic started. Many ideas have been floated around on looking for other sources of revenue, diversifying the economy, and I've talked about this many times. Here's a little slightly different take on the issue by looking at domestic tourism versus international tourism. So a tourism expert at Udayana University said that Bali needs to stop deifying foreign tourists. He argued that the pandemic is a lesson for Bali to grow out of its dependence on foreign tourism. Pak Nyoman Sukma Arida, a tourism lecturer at the Udayana University, said that Bali needs to stop depending on foreign tourism because after the pandemic is over, there is going to be intense competition for tourism, and so it's going to be even harder to get foreign tourists than it was before the pandemic. Sukma said that tourism players in Bali ought to focus on attracting domestic tourists, not discriminated against them. And he said, and this is an interesting quote, "We've observed how Bali differentiates treatment between foreign and domestic tourists. But this doesn't happen in other regions like Yogyakarta and Malang, where both tourists are treated equally." So, issue of are domestic tourists treated differently? Is there discrimination against domestic tourists compared to international tourists? Some people say yes, some people say no. My personal experience is yes, there is discrimination against domestic tourists, whether that's going into certain clubs or getting discounts or any kind of special treatment. But that's just my experience. So anybody that has some experience here would like to kick in, be glad to see the comments. Sukma added that the pandemic is changing people's traveling patterns and staycations are rising in popularity, and so he said that Bali needs to tap into that potential in order to support the local tourism industry, and it should do that by developing tourism villages because he thinks people are going to move away from choosing potentially crowded destinations. And I know what I'm thinking about. I want to travel around the island in another few weeks. I'm thinking, where do I want to stay where there's going to not be a lot of people around me? So he added that before the pandemic, Bali leaned towards mass tourism, and this has been something that's been argued for a long time too. Mass tourism versus quality tourism, quantity versus quality. And he says that in the future, Bali needs to change. They need to get away from the idea of mass tourism and move into quality tourism. In our last full year of tourism, there were 6.2 million foreign tourists that arrived, with Australians and Chinese being the major countries contributing. And there were 10.5 million, I read 11 in some places, 10.5 million tourists, domestic tourists, who visited Bali. So in terms of numbers, Indonesians still make up the majority of visitors. So will Bali make some changes in terms of tourism? Are there going to be tourism villages? Are things going to be more spread out? Though there's been talk about this, about using the app to track people once they get here and see if there's so many people at one place to cut off the numbers. Those may have been fantasies that discussed at one time. I haven't heard about them since then, but we don't know what Bali's really going to look like once it opens up. And so, yeah, we're just going to have to see. This is a work in progress. Does anybody know what they're really doing? I don't know. Okay, and time for a wrap-up. So, another good news cycle. Numbers going down, down, down. And we have restrictions, of course, ending tomorrow. And what will the president or one of his spokespersons say? Spokespeople say? Well, is there a possibility that Bali will be dropped to level 3 now that our numbers are decreasing so rapidly? It's a possibility. And if we do go down to level 3, how is that going to affect us on the ground? Are we going to have more things open up? Are we going to see an increase in domestic tourism, which would be highly welcomed? International tourism still seems a ways away. What about the B211s and those kind of visas? Nothing yet on that. As long as we have the PPKM, I can't see that being changed at all. So there's a possibility that the government's going to switch their policies. We're going to look at containment and control rather than getting rid of the virus. That may affect how the government goes about opening up. Now, you heard earlier when those numbers about November 2022 and months before that. How many months before that? Are we looking at not having foreigners here before the end of the year? That's a possibility. Maybe there'll be some opening up slowly, maybe travel bubbles open up. So in terms of just showing up here, getting visas on demand, that looks like it's not going to happen for a while. So that's not the best news for people that want to come here and for everybody here that wants to go back to work. And I'm continuing to be increasingly concerned about issues about mental health problems arising because of this long state of restrictions and the continuing deterioration of the Balinese economy. So it's something I'm keeping an eye on. I know it's affecting people in my family, including me. There are times when it just seems like it's never going to end, that my granddaughter is never going to get back into school, that my kids are not going to be getting jobs, that businesses are not going to succeed. We're hanging in there with the encouraging signs, and so I'm feeling positive today. The encouraging signs of the numbers going down, the numbers going down, the numbers going down. Part of this is, as the government officials say over and over again, people have to take responsibility. They need to wear a mask, they need to social distance, they need to follow government regulations and protocols. because if they don't, we'll never get out of this. And good news with the vaccinations rolling around, and we're up over 40%. That is great. Now, we have to remember that Indonesia is a big country. Bali is just a small island here, and so we really need to get the whole country vaccinated. And in a larger sense, we need to get everybody in the world vaccinated in order to get this down to where it can be controlled and become just another problem to deal with in life. That's about it. I did a video a couple of weeks ago, another interview with Mark from Every Man Has a Story. And on this one, I was talking about anthropology and human evolution. If you're interested in those, you can take a look up here at the link and listen to it's a long, it's a long video. Maybe you just want to listen to a little bit. Unfortunately, there's no timestamps there because our interview went here and there and here and there. I really enjoyed talking to Mark about that. Okay, so that's it. It is Sunday, as I said, and a great day. And I hope that you're doing well. I hope that if you want to come to Bali, you will get to be here soon. And if you do, pop on up to the north and visit. I'd love to meet folks that watch these videos. And take care, stay safe, be kind to someone today. See you next time.